Welcome to Talk to Dr. Tiwa live show. Welcome to the April edition. For those that are just joining us today, I am Dr. Tiwa Oshinfisan. I'm a practicing psychiatrist, a physician capacity strategist. I'm a mental wellness advocate. Let's put it that way. I help professionals protect the most valuable assets themselves so that they can function the best without losing themselves in the process. So it's today's topic is an important topic to me, and you're going to find out why. And I have somebody with me, an expert. I'm going to read a long bio very soon. She's just very excited to have this conversation with her because it's about protecting our children. That's our future. That is our treasures, and they're very vulnerable. So you agree with me, right? We need to talk about them. We need to find ways, communities, because child safety is everyone's responsibility. So we have a lot to talk about. If there's somebody that needs to be here, please call them, let them know, forward this link to them, broadcast it to your community, to someone that needs to listen. All right. And so with that, we're going to get right in, and I'm going to welcome Dr. Adefolake Akinsanya. Thank you so
Thank
much for
you.
joining me today.
Thank
It's
you, Dr. Shifisan, for having me. It's a pleasure.
so great to have you. All right, I'm going to go straight to your bio, and then afterwards you can tell us other juicy things that I may not have captured. So, about Dr. Akinsanya, Dr. Adefolake Akinsanya is a double board certified psychiatrist and child and adolescent psychiatrist whose career has been built at the intersection of trauma, advocacy, and the care of the most vulnerable young patients. She currently serves as service chief of the adolescent female inpatient unit at Shepherd Pratt Health System in Maryland, USA, one of the country's most respected psychiatric institutions, where she has worked since 2019. She's born and educated in Nigeria. Dr. Akinsanya completed her medical training at Obafemi Awolowo College of Health Sciences and Windsor University School of Medicine before going on to complete her psychiatry residency at the Case Western Reserve University and a child and adolescent psychiatry fellowship at the University of Alabama at Birmingham, United States. That training grounded her in the clinical realities of trauma across the developmental spectrum from early childhood through adolescence. Our research has focused on PTSD, post traumatic stress disorder, treatment in children and adolescents, psychotropic care in the foster care system, and disaster psychiatry. She has presented her work at national conferences for both the American Psychiatric Association and the American Academy of Child and Adolescent Psychiatry. Beyond the clinic and the research, she's a court appointed special advocate and a Red Cross member. Two roles that place her directly in the lives of children navigating systems that have often already failed them. Dr. Akinsanya also holds faculty appointments at the University of Maryland and the University of Alabama at Birmingham, where she trains the next generation of psychiatrists. She's a fellow of the American Psychiatry Association and a distinguished fellow of the American Academy of Child and Adolescent Psychiatry. So, if wherever you are, let's give Dr. Akisai a warm welcome.
Wow, wow,
Thank
wow, wow,
you.
wow. Such an
Thank you.
interesting bio, Dr.
I
Shifisan.
know,
Thank
I know.
you.
Which is why we're glad you could join us today. We know you're busy. I know. Being on call, I get it,
Oh my
doing a lot, but really appreciate you for taking out time to educate our community. You know, with the lovely intro, is there anything else you want to share with us so that those that don't know you or
No,
that
I mean,
don't
I'm
know
also a parent. I really enjoy working with children. I mean, I've always wanted to work with children. It's my passion. I'm an aunt, I'm a sister, I'm a daughter, I'm a friend, so yeah, it's a pleasure to be here.
That's fantastic. So I look forward to a robust and meaningful conversation. So you being all I've read and much more, what does a typical day in your world actually look like?
That's very interesting. I mean, you know, I have two jobs, one of them being a mom, and the second one being a child psychiatrist. So you wake up in the morning, your job as a mom comes first. So you pretty much have to get your child ready for school, be there for your child, show them that they're priority, and then you get ready for work. When I get to work, typically it kind of just looks like seeing patients. I work in the inpatient, so we see patients that are dealing with immediate mental health crisis. So you see them, you help them navigate, you talk to their families, talk to other parties involved or other like stakeholders in the patient's care. So we pretty much do all of that every day. Sometimes we get involved in like, other kind of administrative meetings that again involves patient care. Other times we go to conferences to kind of brush up our skills in how to be better physicians. But yeah, pretty much my day looks like, first occupation as a mom, second occupation as a child psychiatrist.
That is exciting. Thanks for sharing. Why child psychiatry? I mean, maybe we should start off with why medicine, and then why just child psychiatry. I'm a psychiatrist too, but you are the one deciding with the child. I got exposed to child psychiatry, but I chose,
No,
the trauma side, adults 18 and above. So maybe number one, for those that don't know you, why psychiatry? Or
yeah,
maybe why being a doctor? And that may be one.
right.
Why psychiatry? And then why child and
Mhm.
adolescent psychiatry for you?
Why psychiatry? I mean, why not psychiatry? You know, um, it is psychiatry is like it's this very interesting field where it's evolving, it's growing. There's not enough people. There's a lot of stigma. There's significant room for advocacy, and I'm very big on advocating. So like, going into medical school, I had different dreams. I was like, I was going to be this, that, but when you go in and you see the gap, right, once you see the gap, you're like, this is what I want to do. It's one of the reasons you become a doctor. You have this thing about you where you want to help people. You're trying to be altruistic. So when you go through medical school and you see that gap, I wanted to be able to fill that gap. I wanted to be able to bring that experience. I grew up in Nigeria. Of course, I think it goes without saying how much stigma and how much gap mental health has. So that was what drove me to go into psychiatry. But why child? I've always wanted to work with kids. Like it's growing up, I would like babysit all of my nieces, nephews, cousins, neighbors' kids. So going straight into psychiatry, I knew I was going to work with kids, but then being in psychiatry itself and seeing where it starts from, that was like where the passion for me grew. It's kind of like it's saying like we have to catch them young kind of situation. So I decided that, I wanted to work with kids, see what we can do to help kind of grow the next generation, build a better world, and things like that. Yeah.
That's great. That's inspiring. So hopefully somebody that is listening to us is just wondering, oh, I don't know what I want to do in life or career. So thanks for letting us know, like again, paying attention to our passions at a young
Right.
age. It's not that deep. It's not rocket science. Just paying attention. What do you enjoy? What do you like? What do you do? And then just going from there, and that can just guide you as to what profession aligns with that passion. So thanks for sharing. So it's April. It's Child Abuse Awareness Month, and our conversation today is beyond bruises. What does that title, mean to you? Why does it resonate with you so much?
The title,
Yeah, beyond bruises. I
I,
mean, pretty much why we're here to raise awareness, but beyond
yeah,
with what you do, what would
yeah.
you say about that? Yeah. Yeah.
So beyond bruises, right? It's kind of like the word says. It's like looking beyond what's on the outside, looking beyond somebody's physically abusing a child or physically abusing an adult. There's understanding that there's a lot more to trauma than just seeing it on the outside, and making sure that we're aware of that and we're looking for those signs, right? And as we get down in this conversation, you're going to hear us talk about different kinds of trauma and what to look out for. But for me, I think it's important for people to even be aware that because you don't see a bruise, because you don't see a mark, doesn't mean it's not happening. There could be emotional signs of trauma, there could be behavioral signs of trauma. There are different signs of trauma that, again, as we go down, we'll be talking to you guys about to kind of watch out for, so that we're creating an increase in awareness, and then you can pass that along as well to other people.
Correct. And I'm glad you said that, like you were saying that it's not just what you see, some people may not have those marks. But one thing you also said is why I thought this conversation was very important, that you want to shape the lives of of our generation, is the future, and they're very
Right.
vulnerable. These are critical moment, and with what we know with brain imaging, some of the impact of this bruises or this the experiences are lifelong. That it takes 10 minutes of 1 minute of negative impact, but it almost takes a lifetime to unpack that impact. And so, I mean, with what you do, you're seeing them on the inpatient, almost, another spectrum. Maybe some of your colleagues, even seeing them where they're in the clinic, and you're just like, that different phases, different facets of seeing them. And if you don't attend to them, if you ignore what they are, call it attention, call it, they're just seeking, the famous one I hear is they're just seeking attention instead of paying
Yeah.
attention to that behavior. It can really be a lifelong consequence. So thanks really for sharing that. So when most people hear child abuse, like you were saying, that it's not just the marks, they picture physical bruises. From your clinical experience, what are the different forms of abuse that go most undetected, and what would be the reason for that? What would you say?
So there is physical abuse that everybody knows. Like, somebody hurt somebody, somebody smacked somebody, somebody's always beating up somebody. Um, but there's other kinds of abuse that people may minimize, right? So we talk about neglect. Like, neglect is actually a big one, right? So neglect talks about like inability for a parent or a parental figure or a guardian to provide what a child needs to thrive. We're talking about lack of food or food housing instability. We're talking about clothing. We're talking about access to good health care. We're talking about access to adequate finances to do basic living. We're talking about an unsafe community you're living in. We're talking about limited access to good education or even just minimal education or quality education. We're talking about discrimination. So those kind of things can encompass to form neglect. Then we move from neglect, we talk about natural disasters, right? A war is happening, a tsunami, and a hurricane, a flood. Those are kind of like trauma stuff. We're talking about violence. So somebody lives in a place where there's constant violence on the TV, next to them, in their school environment, things like that. We're talking about somebody either being a victim of an assault or somebody witnessing somebody else being assaulted, right? So we're talking about other life changes, such as a child with parents going through a divorce. We're talking about a child with parents going through a divorce may not necessarily be traumatic, but like the divorce itself is traumatic. There is like a contentious battle and the child is in the middle. That can be traumatic for a child. We're talking about in the household dysfunction. Parents are not divorced, but there's constant bickering, yelling, violence between the parents that this child is being exposed to constantly, right? We're talking about parents who use drugs, alcohol, and are not able to be physically present for the child to nurture the child that could be seen as another form of neglect. We're talking about a child experiencing bullying in school, bullying at home, bullying in other settings, right? We're talking about a child experiencing sexual trauma, which is also a huge one. Interfamilial sexual trauma is huge. A lot of people don't know that it's happening. A lot of kids cannot tell. We're talking about sometimes from a parent, we're talking about sometimes from a sibling, we're talking about sometimes from like a caregiver, including teachers, coaches, nannies, uncles, aunties, and people that we're talking about neighbors. We're talking about sexual trauma from peers, from friends, and then we're talking about social media bullying. We're talking about social media exposure as well, and how that's becoming more traumatic now these days. We're talking about inappropriate conversations that's happening through social media. We're talking about people requesting inappropriate images, conversations from our children, and us not being aware of that. So trauma is very extensive, right? And it goes a long way. First, you have to be aware that it's happening, or be aware of different ways that it can happen or show up. And then second, you have to be aware that what do I do about it?
Wow, Dr. Akemi,
Yeah.
thank you so much, for that education. That was really great where, you captured the common ones and the uncommon ones and things to really, it just seemed like it's really good for us to talk about this because it just seemed like there are so many ways our children can be
Yeah.
abused, and if we don't pay attention, we may not recognize, we may miss this, we may not protect them, and they really cannot protect themselves so well, as we've established that they are vulnerable. They don't know what they're going through. Some of them don't even know how to articulate, like you were saying, how to communicate, and so it just seemed like pretty much they can be taken advantage of in any setting.
Any
That's kind
scenario.
of, yeah, any scenario, because you've listed, those ones. And I'm glad you captured the adverse childhood experiences, because those are like the ones that WHO or CDC addresses in America. So, but seriously, I think what is it nine, is it seven or nine of them? Sometimes it's really indirect. We have the sexual one, we have the physical, like you said, but the environmental ones, based on the community, based on the dad and mom, at times the most dangerous threat to a child
Yeah.
is the parent, unhealed parent, unsafe parent, hungry parent, angry parent, and it's just the children are victims of what they didn't ask for. They're victims of their situation. So I'm so glad you captured those different scenarios and different facets. So you've told us this now, Dr. Akiemi. How can how can we recognize, what are the signs we should look out for, for this child that comes, what should we look out for? I'm a parent, the parents listening, some are joining us right now, just, they may even, maybe they're teenagers and they want to listen, but most are adults, maybe parents. What should we do? How can we recognize them? How can we recognize those signs in our children?
Thank you. It's kind of like we talked about in the beginning of this conversation, right? Like understanding that it's not just by the bruising, okay? It's not just because you don't see a bruise, it didn't happen, because one of the biggest mistakes we can make as a parent or guardian or custodian or human being is to minimize somebody's trauma, or to say that it didn't happen, right? Or to say you're overreacting. Because people experience traumas differently, and people react to trauma differently, because people's resilience are built differently.
Right.
So when you want to watch out for stuff, you want to watch out for, of course, the physical bruise if it's present, but you also want to watch out for a sudden change in a child's behavior, right? What can that look like? A child that used to be very social before suddenly is withdrawn. A child that was withdrawn before suddenly socializing, like overtly socializing, constantly seeking pleasure in different places in different ways. They start to use drugs, which is not typical of them. They start to hang out with the wrong crowd. They're doing promiscuous things. They start dressing promiscuously. Um, some of them they start becoming very irritable. They start getting agitated. They get aggressive. Some of them, like a child that has had bladder control before, starts having incontinence, meaning either they start bedwetting at night or even they're peeing on themselves during the day. They also sometimes will lose bowel control, which means pooing on themselves either at night or even during the day, right? Some of them also like are talking about like things like trying to get your attention more. They're getting more clingy, and you're wondering what's going on with my child. Some of them start to forget things very easily. They become more inattentive. Their grades are dropping in school. Everybody's telling you they're spacing out in class. The teachers are complaining. They're saying this is not typical of your child and things like that, right? Some present even more actual, like they would present with actual mental health symptoms, like increased anxiety, severe depression, you know, insomnia, difficulty going to bed alone at night. They don't want to ever be alone, uncontrollable crying. There's a change in their eating pattern, and things like that. So it's very important to know your child and to know when things change.
Hmm. Thank you so much, Dr. Akemi, for Akinsanya, for just capturing those what we can do as parents so that we don't feel helpless. Because at times that helplessness is it can be frustrating. Let's put it that way. So
Right.
I'm glad, Dr. Akinsanya, that you were able to really just give us those immediate things we can recognize. So if I heard you correctly, is understanding our child. We really need to understand our children so that they have a baseline that you're working with. You have the normal, so that when there's a change, it is easier to recognize. No, I don't even know my child, so I don't know if this is normal or this is different. So it sounds like the key thing is understanding who they are at their normal times routinely. And then if there are changes, what do we then do as parents? So if there are changes right now, okay, Dr. Akem, I have a colleague that is Dr. Akemi. So
I was
who knows
wondering where
Dr.
that was
Akemi?
coming
Yes.
from.
I have it, yes. Who knows?
I
One
was
of these
like,
days
I
I may
mean,
bring her. Yes. So she's a
okay.
psychiatrist and a colleague of mine. So, but just imagine, what do we then do as a parent, Dr. Akisanya, with all of this? That okay, we recognize this, like you said. What do we do? So we've paid attention. This child is more irritable. This child is more clingy. Maybe this child now is even telling us, I want to kill myself, or I'll cut in, and I don't want to be here, or yeah. So what do we do? Or now, like you said, bedwetting. What do we do?
I think that's very, very scary for any parent, right? You know, s- and I try to like, because I'm a parent and I try to think about what do you do? How do you respond? I think whatever response you have is valid. I just want to say that because it's a situation that you've never been dealt with before, right? So, as a parent, you notice a change in behavior of your child, you dig deeper, you find out your child has been abused in however form that they reported to you. Your response or your reaction at that moment is valid, irrespective of what it is, right? What we're doing now is to bring awareness so that you can prepare for a reaction, right?
Correct.
So that you can
Yes.
prepare for how you respond to this. Um, I think the first thing we always try to talk about parents is to anyone, parents, guardian, anybody, is identify and validating. So somebody, you notice a change with your child or your ward, you talk about it with them. They open up to you, luckily, thank God. How do you react? I think the first approach is validating. what they're saying to you, right? You want to make sure you're not blaming your child. You want to make sure you're not playing victim and not say, oh, why is this happening to me?
Yes.
You want to
Yeah.
make sure you make it about the person that's telling you the situation in the moment. I mean, you're allowed to feel all your feels, but I'm talking about in the moment. But even like the bigger question is, how do I even approach my child if I notice a change or a difference,
Correct.
right?
Correct.
It's like you do, right? You just do. You sit your child down, depending on the relationship you've built with your child, and you bring in the trust and you start talking about it in a very empathetic way. You don't try to be judgmental. You don't try to like say, you're failing your grades, you're bedwetting again. What's all this nonsense? You want to recognize it's out of character for your child. Once you recognize it's out of character, approach it from a perspective of concern, right? Once you approach it from a level of concern, that's going to go a long way. Now, whether your child opens up to you or not, you have done the most important thing. You've approached it
Mm.
with concern. The next steps is going to determine how this pans out. Talk to a close friend or a close colleague if you're not getting through to your child or your ward. Seek professional help. Take them to see their pediatrician. Take them to see their school counselor. Take them to see a trusted adult or talk to a trusted adult that your child has. Because believe it or not, that may not be you.
Yeah.
And it depends on the age of your child. It's a hard truth, but it may not be you. If your child is a teenager, it may be a coach at school. It may be the school counselor. It may be their best friend's mom,
Mm.
right?
Yeah.
Do not make it about yourself. If you cannot find out, think about how to find out.
Mm.
And once you find out, think about how to get them help. Because that's the next step and most important thing that they need in what they're dealing with.
Wow. Wow, Dr. Akinsanya, thank you so much. Wow, that was a lot because it's multi-layered, you know, the support that you can provide. So it's not one size fits all from what you're saying. It's not do this, do that, and that's it. But there's something you said that is profound for me, and I just want to elaborate on that. Is the validation piece.
Right.
So Dr. Akinsanya is the child adolescent. I'm the adult. So when they come to me at 18 and older, I see what was not or what Dr. Akinsanya is already doing. You know, they come to me. And what I tend to hear is more so my parents didn't believe me. My mom didn't believe me. Or unfortunately, the mom too was abused. So guess what? Okay.
Keep going, Dr. Tiwa. I just want to turn on my light.
Right. Okay. So one of the most heartbreaking things for them as an adult when they're seeing me is uh, my mom. My mom didn't believe me. My mom said I made it up. My mom said, "Okay, that's all of us. What's the big deal?" I think those ones are very painful too because the mom too has been abused. So guess what? There's a generational pattern. And that's one of the reasons I wanted us to have this conversation because it's not just one child. When we protect one child, we're protecting generations, we're protecting legacies. And when we don't, it's the exact same thing. And that's why we have the generational cycle of trauma, generational cycle of pain, generational cycle of everything negative. So, I mean, I'm sure people listening to me now can see why I'm just really so passionate about it because it's when by the time they present to us or present to me as an adult, I won't say it's too late because nothing really is too late. It's better late than never. But a lot of damage has been done. And so, and then you hear some parents, oh, I didn't know. That's what breaks my heart. I didn't know. I didn't know. And several of the patients will tell me they never told their parents until maybe when they're talking to me. They're like, oh, I talked to my patient, maybe 45 years old. Like, well, I told my parents when I was 21. I told my parents when I was 30. I told my parents last year before my parents finally died. And you're like, and you hear things like, I actually don't know what my mom would have done. Or my dad. My dad would have killed the man. Or I told my mom, and my mom didn't tell my dad because my dad would have been so upset at my mom. So it just like you rightly said, it's not about you, it's about the child. So please hear us, okay? And if there's still somebody that needs to join and listen, please share at this time. But as Dr. Akinsanya said, it's really not about you. It's about that child and the series of events that would happen after. It's an it may have been a 1 minute event with a lifelong impact. So, as a parent that you're hearing me, this is a big deal. This is life changing. This is life altering. So please treat it as such. So I like all the things you said, Dr. Akinsanya, when you're just like, you know what, it may be painful, but the trusted person may not be you. And it's not personal. It's not. It's not personal. There are different stages. Your parents will not be your confidant at all stages of your life. There are days you want to talk to your parent. There are days you don't want to talk to your parent. And that is freedom of humanity. That is not peculiar to children alone. That is life. So you heard what Dr. Akinsoye said. He really, who do they need? What do they need the most at that time? It can change later, which brings me to my next question, Dr. Akinsoye. If the question is recognizing, if the question is the support person they need may not be us, what should we be doing then? Maybe I'm jumping ahead of myself, but I'm just curious while we're here. Should we wait then until there's trauma and disaster? Or what should we be building when everything is fine? Should it be until there's abuse before we start panicking? Who is the best friend? Who is this? Tell us, what should we be doing in the preventive stage before trauma? What should we be doing right now when everything is fine? What should we be doing?
Yeah. I mean, we're doing one right now. We're educating, right? Um, but more importantly, what should we be doing in our households, right? We talk about parenting and we talk about what that looks like. We talk about how do we build an environment where we're nurturing our children, right? How do we build an environment where we give our children the things that they need to prepare them for this kind of things if they happen?
Mm.
We're talking about we can't fully protect our children. I need to say that upfront,
Mhm.
right? But
Correct.
we're talking about making sure we're creating the right environment for those things. So there's three things about parenting there's different kinds of parenting. There's authoritative, there's authoritarian, and there's permissive or whatever they call it these days. I don't know if they're calling it gentle parenting or whatever,
Attentive parenting.
but
John, it's okay. Yeah.
but there's all of these things, right? But the most important form of parenting talks about nurturing, boundaries, consistency, and presence,
Mm.
right? So for everything that we do, we need to be present for our children. And I'm not asking you not to go to work. I work. I'm at
Like,
work right.
should I quit my job, Dr. Akinsanya?
I'm at work right now. It's a Saturday. So
I'm quitting my work tomorrow.
no, no, I'm not asking you not to work. But I'm telling you, when you're present at home, be present. I need you to hear that.
Okay.
Be present. Come down to their level. Do their homeworks with them. Give them a bath. Read a bedtime story to them. Have dinner together. Have an activity you do. Have a ritual or routine, even if it's once a week dinner together. I don't have dinner all the time with my kids. Just make sure you're present. That's it's called quality versus quantity.
Correct.
So that's one. Boundaries. Your kids need to know you're the parent. You're not their friends. You're not their colleague. You're not their teacher. You're not their boss. So it's kind of like a balancing act. They need to know you're their parents. So there's boundaries. They talk about like boundaries is kind of like you want your child to do something, you're negotiating. I'll give you an example. You want your child to um, come do their homework, and you're asking, can you come do your homework? Versus, Johnny, it's time to do your homework. Or, Johnny, I need you to come over here and do your homework. You're not negotiating with your child when you start using the words can, is it okay? All those kind of things feels like negotiation. And there's different stages in different age groups that a child can have those things where you can negotiate with
Correct.
your child.
Correct.
In
Correct.
early in life, especially the first 5 years of life, where 90% of a child's brain is developed and a lot of things is being taught, that's not a negotiation phase. I just need you to like hear that when I say it. So boundaries. Your children need to know who is the parent, who is their friend. So boundaries. Nurturing. You know, we grew up in Nigeria where they say if you it's not that I'm encouraging smacking, but they say something like if you smack a child with your left hand, you need to draw them closer with your right hand.
Correct.
Nurturing. So when you reprimand your child, you also want to draw them closer. You want them to understand why you're giving them a consequence, right?
Correct.
You want them to see it's not a punishment. You want them to, so nurturing. How do you nurture your child
Okay.
to feel loved and cared for, right? So boundaries, what I say, boundaries, nurturing,
Okay. Present.
presence, and I think I'm blanking. I said four things.
Yeah. Yeah, I know
I
you
don't
said
remember
four
the
things.
last
Yeah,
one.
yeah, but I think the key thing was the boundaries, the presence, nurture, and
Right.
I think those were like the maybe
Consistency.
authority,
I did say
consistency, the
consistency.
authority.
So, like, the other piece of it is whoever you're parenting with, you all need to be on the same page. So, if you're the only one doing all of these things and the other parent is not doing it, there's a gap. So all the good cop, bad cop, it's neutral cop.
Neutral cup. I like that
It
actually.
is because,
Mm.
like, if we're not all consistent, and again, I'm not saying that we shouldn't have a relaxed environment where a child feels like that. That is always going to happen.
Oh
But
yeah,
if you say, I need you to do your homework, Johnny, Johnny should not think that I can go to dad and say, I don't want to do my homework, and dad will say, that's okay, buddy, let's watch TV. Johnny should not be able to think that in a household.
got it. Okay, okay. So thank you so much, Dr. Akinsanya.
Right.
So it sounds like we also need to understand the different stages and phases
Mm-hmm.
of our children.
Right.
So what they once needed may not be relevant now as they get older. And what
Right.
they didn't need may be what they need now. So again, it's not always this is what we do till they are 18. Is that okay? What is the psychological need at
Yeah.
this time? What kind of parent should I be to them
Them.
at this time to have for them to have the best outcome in life is what I'm
Yeah.
hearing you say. You know, you said many things. You know, there's the gentle parenting, which I'm not a fan of. I'm not a fan of gentle parenting. I'm a fan of intentional parenting. So
Yeah.
with intentional parenting, is there's a goal. What is the purpose at this point? Most of the time, gentle parenting to me is a function of it's almost like a trauma response. of a
At least
parent.
whatever social media has made it look like.
Social, yeah, what social media makes it look
Yeah,
like a parent that was probably abused, taken advantage of, and then is skewed almost to the extreme where now you just don't want you are absolving yourself of your parental responsibility.
yeah,
So, but there's intentional parenting, like you said. Intentional parenting to me is that neutral cup that you mentioned. It's not consequences. Sorry, it's not punishment. It's consequences. You are teaching them. You're present. So there's a phase of can should you come, and there is a phase of this is what you need to do.
right.
So if we use gentle parenting across board, we actually lose the intentional parenting because gentle parenting is not for every phase.
Yeah,
So it cannot be a prescription, it cannot be prescriptive
right.
for parenting if it's not relevant to every stage. So for every stage, that's why I like the term intentional parenting, where you're really asking what is the best, what is your role as a parent to be the best parent that you can be to this child. So I like
And
what
I
you
think
said.
it's important though to, because like listeners right now may be thinking about, why are we talking about parenting? I think it's important to highlight why we're talking about that, because we're talking about know your child and
Correct.
creating an environment where your child feels safe and
Correct.
can come to you.
Yes.
So that's why we're talking about that,
Right.
because that is the preventative measure.
Yeah. Yeah.
Because remembering that you cannot protect your child from all kinds of disasters and trauma that may potentially happen, the thing you have control about is your environment,
That's great. I'm
right?
glad, and I'm glad you brought that back, which
Right,
is where focus on what is within your control.
right,
You don't want to be reactive. You want to be proactive
right.
and be prepared, and that's where parenting comes. The best gift to a child may be parenting, and the best threat to a child may be parenting too. So in all of this, home is the first classroom for a child. Is the first classroom for, yeah, whether so I always like when we're teaching sex education. When I see it, I'm like, it's good to start teaching children these are my body parts. Growing up, we may not have mentioned that. We may not, oh, don't say this word, don't call it this. But I like that it's good now that we're teaching children early, this is what happens to you. So there's no some conversations that are too big. Yes, I almost said the patient, if the child is able to understand it at this stage, and you want to make sure they can repeat it back to you. When somebody touches you inappropriately, what will you do? So,
Mhm.
as at work, we do, what do you call that? What's the term for that? I'm blocking on it right now. Where we prepare for disasters,
Disaster
where,
preparedness, is that what you're
yes,
talking about?
yes. No, not that one where, even for gun violence, how do you prepare?
Yeah.
I'm looking for the word. It's going to come back to me. But I think these are
Psychological
things,
first aid.
not just the first aid, but it's
Oh,
almost being proactive, just practicing, almost like
yeah.
a simulated environment. But really, how are we prepared? I like what you said about a safe environment where that child can speak. Are they already speaking? If they speak and you don't believe them, why would they speak when they're in trouble, when they feel like they're under attack? So it starts from home and what we teach them. So thank you so much. So for I know we still have some time. So for your role as the court appointed special advocate, what made you decide to step into that role? And what has it taught you that medicine alone could not?
So when I started working as a child psychiatrist, I started to notice a significant portion of patients and kids not having a lot of advocates, right? Um, Coincidentally, the amount of trauma I see at my work is enormous. And, you know, for every 10 patients that I see, at least 8 of them would have some form of trauma. And then for every 10 patients that I see, three or four of them would have had child protective services involved, or Department of Social Services, whatever that's called, wherever you are. And that's pretty much just like the state's way of advocating for kids that are abused, or coming stepping into the kids going through this adverse childhood experiences, that they need to step in for them. But I also found out that even that level of advocacy of the state stepping in was not enough. I mean, I can't speak for the state, but you can think about 10 million factors as to why that's not enough, right? Because the state is taking care of, I don't know. But so I started to see that there was need for somebody who knew what they were doing, somebody who could like focus on a child to advocate for that child. So I researched, I found out this, court appointed state advocate situation where you sign up with the government to be assigned specific patients, that not patients, this is not in the capacity of a doctor. Anyone can actually do this. So this isn't in the capacity of a citizen
Okay.
who cares about people that are, you know, going through stuff, who needs people to advocate for them. So that's pretty much what this is. So I did that not as a doctor, but just like somebody who cares about mental health and advocating. So you step into that role, you pick up, they assign you patients, you advocate for them when they have hearings, when they have school problems, when they have difficulty getting medications, difficulty getting healthcare, difficulty getting the basic things again that they need to be getting. So you're stepping in into that role and advocating for them. Some of them are still in their parents' house. You're just
Mm,
serving as an additional support. Some of them are now in the custody of the state, and you're
mm,
serving as an additional support for them. So for me, I also bring my expertise in making sure I know exactly what to advocate for these children.
mm. Thank you so much for sharing that. That is great. Well done, Dr. Akinsanya, for using your skills. And we just cannot just be a psychiatrist and just be enough. That is not enough. Because
Right.
like you had really said, there are a lot of gaps, a lot of gaps.
Yeah.
And like I like what you said about this work. That's why we're increasing the awareness, raising that awareness, where we may not be able to go, but our voices can reach. So thanks for what you do. The questions I had, so I remember the word I was trying to remember. It was the drill. Have
Yeah,
like a
you
drill. It
actually
was
said it
drill.
during your stuff.
Exactly. It was drill that I was like, how can we practice? In my head, I'm always like, maybe we should practice to be robbed so that we know what to do. In case what happens, stop there. I mean, it doesn't always act when there's trauma, when we're under an attack, it's different. We don't even think very clearly. But I think just having that conversation is definitely good. So I'm encouraging you, parents, if you're here with us, joining us, um, have conversations, deep conversations with your children. Ask, has anybody touched you? Has this happened to you? Have you felt scared? That may be the word. Make sure they can communicate. Don't be careless. At times we parents are very careless. You're like, oh, you just trust everybody. Please don't trust everybody. Don't trust everybody, because studies have shown that the most common perpetrators are those that we know. They are those known by the children, those close to the children. So I'm not saying you should not suspect your brothers, your uncles, your sisters. What I'm saying is be cautious.
Yeah.
Watch with your eyes, with your ears, watch with all your senses. Don't just be like, oh, in my time, just go. No, don't just the times that we live in are dangerous times, even more dangerous. I can't say that, but more dangerous at least than when I was younger. I mean, I was telling somebody in Nigeria, I was sharing with someone yesterday, while I went on a field trip with my kid, with my daughter, and I was like, when I was younger, I was just remembering Nigeria, it's raining, children will run out. We run, you can run out naked, you can run out on this, you're just screaming, life is good. We can't do that right now.
No, you
We
cannot.
can't. Yeah, we can't just be like, oh, just go. I mean, I was telling someone, I'll just tell my parents, yeah, you're going to the neighbor. Mommy, I'm going to the neighbor's house. Oh, see you later. Just be back at this time, for you come back. Oh, I lost my watch. You can even come up with all these stories. But we can't do that right now. You can't just be
Right.
like, oh, I'm taking the kids to my neighbors. So we really cannot, which is very sad, and which is going to bring me to my next question, Dr. Akinsanya. Like, as communities listening to us, maybe before I get there, let's
Mm-hmm.
do it. As communities listening to us, communities, faith communities, school communities, whatever community that is listening to us right now that have a child around them, with them, what is your message to them, especially since child safety is everyone? It's not the doctors alone, it's not the parents alone. We say community, I mean, children are raised in communities. You might have been born by parents, but we always say, you're raised to, it takes a
Take
village.
the village.
Yeah, that's what we say. But lately, it's no longer taking the village, because the village is becoming very scary lately.
Yeah.
The village right now is now the cause, because we trusted village. So, but we need the village, because the parents, like you said, if the parent is not going to quit their jobs, from what you're saying, if the parent is not going to be alone to protect that child, and the village is not safe, what do we do? So you've spoken about parenting. What can we do? What should the villages and communities do to keep the children safe?
So it's I don't know, that's like a catch-22 thing. But one of the biggest things that I would say is see something, say something.
Okay.
That's very important as a community. Like, the more we say something about an incident, about a situation, the more we're getting rid of predators in our community. Or the more we're increasing awareness. Because when people do stuff and they feel like they can get away with it, they will keep doing it. So if you're the one that found somebody doing something, if you're the one that heard about it, please report it. It's very important to be aware of who you can report things to in your community. If you don't even know what to do, say you're in school, go to your counselor. Say you're in the community, go to somebody's assaulting a colleague at work or whatever, go to your HR. Say you are in just outside that, call 911, go to the police. But again, see something, say something. But more importantly, in the community, I think we can try to also be aware of the impact of what we do, our behaviors, and what we're allowing people see. Because,
Mm,
like we said, the children learn by example. What are you posting on social media? What are you saying when you're in a gathering? What are you doing around children? What are you preaching by body language, by action, that it's okay? So be mindful of what we're doing around children, around our community, to make sure that we're passing the right message across to people of what's okay and what's not okay, what to accept and what not to accept. The social media is a big one. A lot of us go on social media, we're making comments, we're bullying people in comment sections. But what we're also doing by doing that is we're teaching the next generation who are reading those comments that it's okay to do that, right?
yeah.
We're taking people's pictures, we're posting them, or we're liking pictures that are inappropriate that people are posting, and we're teaching people that that's okay, right? So it goes beyond a lot. If you see an inappropriate picture on Instagram, report it. If you see something inappropriate, report it. The little things that we do every day shapes the future of what we want it to look like for the next generation. And I'm saying this very importantly because, and I'm sorry to say, it seems like we're not shaping the future right now.
Mm, mm.
It was shaped differently for us in a good way,
Yeah,
but it's not looking like that right now. We are
yeah,
responsible for how we're shaping the future.
yeah. That should be like a mic drop. Mm.
Or it should be like on a t-shirt.
Yeah, on a t-shirt. Yep, shape, and that maybe that's what we need to do. We just have a t-shirt, shape the next generation,
Right.
or we make it a question: Are you shaping?
Right.
How are you? How is your shaping going?
How is your shaping going?
But thank you so much. You brought it home. You summarized it very well. That to help the next child, it starts with us.
He does.
That's the bottom line. We can go around, scream, policies, be people with the policies too. Everybody. I think I believe, and this was one of the reasons I wanted us to have this conversation, Dr. Atkinson, is that if every listener, both now and future, those that watch replay, if they live understanding that it starts with me,
Right.
we would have succeeded.
Yeah.
That's the bottom line. Because child safety is really everybody's responsibility.
Responsibility.
Because they're just like, oh, that's the child. No, but you that saw something, I didn't say something. Silence is never acceptable. Never. It's never the way forward. So I love what you said about see something, say something. Speak up, say something. Seek help, ask, spread the awareness because we are shaping the next generation. We're shaping the environment. We're shaping, and like you said, we're telling them it's okay, we're telling them it's not. So I know we only have a few minutes left. I'm going to try to bring it home. I know there was a question of, well, you're a child psychiatrist. Well, I can just say it. But one of the question was, we now have an adult right now that is listening to us that was a victim
Yeah.
and is wondering, okay, I'm a professional, or even I'm a doctor. What do I do? And even before then, one of the things you mentioned, and I just wanted to address that, is for those in Nigeria and countries where, unfortunately, maybe the legal system is not the best. Do you have any suggestion for them? Because we mentioned in America we have 911. You call the police, you report, we have CPS. I want to file, hello, I want to file a CPS case, anonymous reporter. In Nigeria, what do we do? Because what do we do? The Nigerians listening to us now,
Yeah.
what
I
those in
really love
Nigeria?
this question. I feel like a lot of us that grew up in Nigeria, we're very resilient. A lot of people say that about Nigerian people. You're resilient, you're high functioning. But I
Yes,
feel like behind that, there's a lot of trauma. There's a lot of survival mode that we're jumping into. And I feel like people don't realize that until it pushes them to the wall, until they're burnt out,
yes,
until it gets to a point of no return, until it starts showing as depression and anxiety. It starts showing as you want to be perfect in everything that you do.
correct.
While those are like great qualities, that's not. It seemed like great qualities. It seems like, oh, this is like the survival mode. This is how I've known how to function.
Yeah,
You need to take a pause. You need to be able to recognize this is not normal. You need to be able to reflect. I went through this. Even if you don't want to talk about it with somebody or if you don't want to report it anymore, seek the help.
okay.
Because survival mode is not a great mode. You
Hmm.
may be functioning and excelling greatly in work, whatever, something else is suffering.
Correct.
Something else has got to be suffering. So, help is not a bad thing. Mental health is not a bad thing. Do not feel like you know what the therapist is going to tell you.
Yeah.
Do not feel like, what is the therapist going to tell me that I can tell myself? Because high functioning people say that a lot.
Yes.
There is a difference. There's a reason they call it help. Please get help, address your trauma, reflect, and give yourself some
Mm,
grace.
mm,
It's not your fault. Remember to always pause, take a moment.
yeah.
All
Thank you
right.
so much.
Self care is care. Mental health care is care. Mental health is physical health. And then it reflects on the rest of the people, including your children and what you're doing with them.
Yes. That is so
Yeah.
true. That is profound, Dr. Akinsanya, because as WHO said, there is no health without mental health. And
Right.
is the bottom line, is the truth. Because you can't mental health is one thing, or illness or wellness or mental health concern is one thing you can't hide for too long. Is going
Yeah.
to is like a stench that would stink. It's a wound. If it's not healed, it would smell. So you can't hide it. So I'm really glad.
Before we go, I want to highlight
Okay.
something. If you're a professional and you're listening to this and you're worried about repercussion to your job or whatever position you have, you don't have to use your insurance. You can pay cash to get the help that you need so that there's no record of
Very
it.
true. Very true. Yeah, you're right. Because it brings me to, well, I was going to say EAP services, but EAP at times may not be as robust. They really just help. Yeah, there's some EAP services that, that's all you need. But EAP may be a good
Yeah.
place to at least start. And they don't keep
What is EAP,
all that
Dr.
is true. So
Shifisa?
EAP is Employee Assistance Program, and they provide counseling, therapy. Usually they offer few sessions, but again, EAP, I'm talking about in America. Some people are in Nigeria, they're like, what is EAP, Dr. Oshunfison? We're not all in America.
But
So that's the,
But also in America, people feel like, especially like you and I are African Americans, so I'm just gonna say, right? A lot of people feel like there may be repercussions by seeking
no, 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 it's
EAP. Like,
good. It's
get
good you said that. And that was what I was saying that
right,
EAP, for example, at my job, they don't record, there's no documentation. So there's
right,
there's no electronic health records that keep there's nothing, it's not traceable. And that's why it's always encouraged. So and that's for I don't know whether it's the standard for every organization in America, but I know that for
yeah,
for a few, that's it. And you can always ask. Feel free to ask. These records, where would it go? But for doctors listening to me, I'm pleased to tell you, maybe not pleased, but find out in your state. There are several states, should I say, is it 32 out of the 50 that have changed their credentialing questions for physicians? So they don't ask you, have you ever had a mental health, psychiatric
no,
admission, sort? No. Actually, they just ask if there are any current impairment. They're not even asking, is this psychiatric or whatever? Is there any current impairment that could affect your job right now? So most states boards have aligned with that. Hopefully, other state boards would do the same. But as a professional, I shared that to say, in addition to what Dr. Akinsoye said, get help. And frankly, what she said, if it's not at your job, get it outside of your job. If it's possible, get help. And help can be different things. I'm a physician, capacity strategist now. So get someone to talk to, whether it's a coach, whether it's a mentor, find a trusted voice. That's the key thing. So that you can find that space to express yourself. Seeking help is very courageous. Very, very, you are doing something many people are afraid to do. So asking for help is a sign of courage. So just wanted to drop that there. So to wrap things up, Dr. Akinsanya, we've spoken about communities. Are there anything you would say for our faith communities, in particular for religious leaders? Anything in particular that, because the reason I bring that up is in the religious community, there's even a higher stigma, unfortunately.
Right.
You can't even just be like, and it shouldn't be. And that's where these conversations they're needed, even in those communities. So, what would you say, to the religious leaders listening to us? Is there anything that maybe you haven't shared? And if it's the same, that's fine. But is there anything other than say something? Because in the faith community, you may not even see something because everybody is just
Yeah.
acting. I'm perfect. I'm holy. The Lord descends on me and ascends into the skies through my head. So, what would you say on how to reconcile that to a religion?
Yeah. I think as it still goes back to what I talked about. You have to approach any situation in a non-judgmental way. You have to be open. You have to validate. You cannot be defensive about anything. So even as a leader, that's even a higher
Correct.
reason to approach that from a non-judgmental way. I want you to be aware, if you're a leader in any space, religious, non-religious, anywhere, to be aware when people bring this kind of things to you. Know the resources, know where to point people to, know what to say and how to
I know what
react.
to say.
Be prepared, because more often than not, we're actually the ones that hear some of these things the most, because people feel comfortable coming to talk to their leaders because they feel like this person should know what to do. So be prepared. And for religion particularly, don't
Mm,
judge. And if you're a leader, religious leader that have the opportunity to be in front of thousands of people, hundreds of people, think about talking about this
correct.
in one of your sermons, in one of your lectures, because people listen more to religious
Correct.
leaders. Yeah.
Correct. Correct. Thank you so much, Dr. Akinsanya. I love what you said. Where since it's everybody, I think I go back to say, since it's everybody's responsibility, it should not be a topic that is off the table. It's a topic we all should
No,
be comfortable talking
talking about.
about in every setting because it affects everybody. And if you don't talk about it, somebody may be a victim of what was not spoken about. Because an abuser, most cases, was once abused. A bully is bullying because of emotional turmoil. So bullying becomes a coping mechanism. So it actually affects everybody. So that we don't excuse it. It's never excused. That's why we need to shine light on it. And conversations like this are very important. So thank you so much, Dr. Akinsanya. As we wrap up, is there, how can people, maybe before people follow you, somebody, last person, just people watching now, what would be your last words to that parent who suspects, to that child, maybe a teenager that is listening to us or that will listen to us? And then I think the community one, you already wrapped it up very well. But to that parent, to that child, to that adult child, I think you already spoke to the adult child too. But to that parent and that child, what are your
Yeah.
last words of, well, I missed it. I missed the gun. I'm sorry. I wish I had this conversation before now, but I missed it. And maybe I don't know how to forgive myself, or my child has changed right now. What would be your last words of where they should start right away? An overwhelmed parent, an overwhelmed child.
Three
Yeah.
things. Three things. When you're abused, it's never your
Okay.
fault. You're a victim. Remember that. Two, it's never too late to seek help. Three, you're not alone. So I want you to take this with you. You're not alone. It's never too late to seek help,
It's painful.
and you're not at fault.
Love it. Love it. Love it.
So when you take those three things with you and make it guide you, even as a parent, it goes a long way. So it's never too late. And there is always light at the end of the tunnel. What light looks like is different for different people, but there is light.
Yeah. I like the way when you said
Yeah.
lights, your light in the background adjusted to
Yeah, I
yeah,
was like,
and like
oh,
it's like okay, it's volume is audio sensitive, like lights, like so, but
it's a
it
motion sensor thing, so I don't know what's wrong
no,
with
but
this. I
that's
can't get
no,
off
that's
again.
okay. You're fine. We can still see you and it works okay. But yeah, I
Yeah.
mean, I like your words. I like the take home message. It's not your fault. I love that. It's never too late to get help, and you're not alone. Just so you know. Again, remember these words. One of the statistics that scares me, and you may understand why again, is hearing statistics like 1 in 4 females has been abused, and one in
Right.
six of males has been. So there's this lifetime prevalence, and it's very frightening. So every gathering where there are 4 women, at least one of them, 6 men, at least one of them. But we're not talking about it because we just act like it's the norm or is everything because the society is not prepared for it. So again, if there's somebody that needs to watch this, share this with them. This is a conversation. It's not going to stop here. You know me. We're going to keep raising this awareness until those that need to know, until the world is a better place, not a frightening place, and until home is probably the best, or a healed parent is probably the best asset to a child, not dangerous. So, Dr. Akinsanya, how can people follow you, reach out to you? They have questions, they have feedback. How can people connect with you?
I'm not a popular person like Dr. Tiwa. So I mean, and I'm not that active on social media, but my name is exactly as it is on
Okay.
LinkedIn. So if you want to follow me, just go to LinkedIn, type in my name, and you would find me.
Okay. Thank you so much. I'm just checking. I'm checking YouTube right now if there are any questions for you. But thank you so much to all our listeners that joined us today. We're really grateful that you're able to make it. I'm just checking if there are any questions as we wrap up. And Dr. Akinson, it's been a pleasure having you with us today with all that you
Uh,
shared.
the
We're
pleasure is
we're
mine. Thank you
grateful. We're
so much for
grateful.
what you're doing. This is
We're
really
grateful.
great. I mean, and I appreciate your passion for, the preventative work and the increased awareness that you're doing. You just keep doing that. I think it's gonna go a long way.
Okay.
Um, and that's your own little way of advocating. That's great.
You got it. That's it. That's my 1 cent or 5 cents, and just beyond psychiatry, just helping others. So thank you. So to our listeners, it's a wrap. Thank
It's a
you.
wrap. Thank
Yep.
you. Till
And
next time.
join us. Exactly. Join us sometime next month for another series. May is Mental Health Awareness Month. So it's going to be rich. All right. Thanks again. Bye.
Thank you. Bye.